deeper into this issue here in North Carolina. Now, prior to the overturning of Roe v. Wade, abortions were legal in North Carolina until viability. That was usually between 24 and 28 weeks. Once the Supreme Court decision came down, a federal judge reinstated a 20-week ban. Again, this new bill would take it down to 12 weeks. A few data points worth mentioning in all of this. The State Department of Health and Human Services says the vast majority, 88% of abortions in the state, do happen at or before 12 weeks. We've seen an increase in abortions here in North Carolina since Roe was overturned. According to the Society of Family Planning, the state was averaging about 3,200 abortions a month before the Supreme Court's ruling. In the months following, that number increased to almost 4,000. It's assumed that is attributable to nearby states restricting their abortion rights. South Carolina, Tennessee, and Georgia, for example, all saw their numbers drop. All right, as for polling on this issue, Meredith College did a survey in the state back in February. It found 57% would like to leave things as they are or further loosen restrictions. See the number here, 35% would tighten the current law. All right, back to the bill. There are some other details here worth monitoring. Abortions could happen up to 20 weeks in cases of rape or incest, 24 weeks for life-limiting fetal anomalies. And there's no limit on when an abortion can be performed to protect the life of the mother. Now, there's also some money in this bill, $160 million, to be used to increase child care access, maternal health care, and to offer paid parent leave for teachers and state employees. There would also be funding for foster care families and parents who are working to finish community college. Maternal health care, that's a big issue. Back in January, in fact, we took you to the mountains where there is only one place in all of Ashe County for women to go.
There's plenty of research that shows that whenever women are able to deliver their babies within 45 minutes to an hour away from their home, there are better outcomes. Not only that, but they have the support that they need, and then they can get back if there are any complications afterwards. And they don't have to miss work, you know, whenever they come to their appointments. They're more likely to actually go to their prenatal appointments if they're close. And so whenever women stay close to home for their prenatal care and their deliveries, the outcomes are better. When women are healthy, then they are able to keep their families healthy. And so therefore they're able, through that, to keep the community healthy.
The March of Dimes, in its annual report last year, listed Ashe County in the category of low access to maternity care. So too was Alexander and Rowan counties. Anson County in our area was considered a maternity care desert, one of 20 across the state. So is this money in this bill enough to fill those gaps? Don't have the answer to that quite yet. Now, as for the bill in Raleigh, likely to clear the General Assembly tomorrow. We'll then see what happens after the governor vetoes it, as he has promised. We're going to keep you updated throughout the evening.